be doing a presentation tonight on a patient that we're going to call Charlie. So Charlie is a 68-year-old male. He's a retired Vietnam veteran. He's living in Vermont now with his wife. His past medical history includes exposure to Agent Orange, some hypertension, hyperlipidemia, diabetes type 2, lower back pain. He comes into the clinic today for a follow-up on some routine blood work that he had drawn a week ago. Looking at the blood work, it was mostly unremarkable, but we wanted to touch on his A1C, which was 6.7 as of a week ago, which is somewhat high, but is an improvement for where he has been. He's been sort of roller coastering up around the 8s and 9s, so we wanted to compliment him on the 6.7. We also wanted to talk to him about his elevated lipids. So when he came into the clinic, his HPI was pretty unremarkable. He complained of a little bit of back pain, a little bit of stomach upset over the past few days. His physical exam was unremarkable. Review of systems was also unremarkable. So we talked to him about his A1C. We asked him what he thought may have brought on the lower levels and what he thought he could attribute to that. He attributed it to lower alcohol intake. He had been walking around, as he puts it, with a water bottle instead of a beer bottle. He also had been cutting down on his pork intake. He loves pork and usually eats it every day, but over the past couple of weeks he's been trying to substitute fish for the pork. So we complimented him on that, said that those are great ways to help lower his A1C. At the same time, we had to tell him that maybe he should cut down on the pork even more. Also add some fruits and vegetables to his diet, some fiber, and improve his exercise to lower the lipids and continue to hold his A1C at a closer to therapeutic level. So we did a lot of educating about the risk factors for high cholesterol and not managing his A1C, which he understood and was very appreciative of. As far as his stomach pain and his back pain goes, he had been prescribed ibuprofen 800 milligrams BID for his back pain previously, and he found that that wasn't quite cutting it, so he started to take over-the-counter Motrin, thinking it was a separate drug, to help alleviate the pain. And that's when his stomach started to bother him. So we informed him that both of those drugs, ibuprofen and Motrin, are NSAIDs, and that if you take those in high enough doses, you'll have some GI upset. So we cautioned him to stick to just the ibuprofen and stop taking the Motrin, and if he needed some more pain relief, try some stretching for his lower back or some heat pads, and to let us know if his stomach pain continues after that. Otherwise, we would see him in July for another routine follow-up and lab draw. Thank you.